Hey there, most of you have been asking for a few more practice problems to anticipate the actions of muscles, use the 5 rules of all muscles, and then anticipate antagonists. So let's check out some muscles of the back and see if we can figure that out. So first I want to give you a muscle that has its origin along the length of the lumbar spine, and then its insertion is going to be along the upper proximal humerus on the posterior side. And so if we were to label that, if you remember your lumbar region, it's going to be attached all throughout this lumbar spine, so like 5 vertebrae worth. And then the insertion point is going to be on the proximal humerus, so up towards the shoulder joint and on the posterior side, right about there. And so you're looking for a muscle that spans between these 2 points and crosses a joint. Well, we're already attached as an origin. This is our anchor point, is the spine, so that can't be the joint that we're crossing. Where we are crossing to get to the arm is to get from torso to arm, we got to go cross shoulder. And so the shoulder joint is the thing that we are crossing. You could say that we could cross across the elbow, but we don't happen to have a wing, as far as I know. And so we're missing tissue there. So the elbow joint is not the joint that we cross. So if we know that, we can triangulate a little bit. We're looking for a large muscle of the back that stretches up to the humerus and crosses the shoulder joint. Go ahead and pause this video, think about it, and see what you choose. All right, did you find it, or did you find a candidate? Let's look. If we're looking for a muscle that stands these 2 points, we want to find the shortest distance across these 2 points that crosses the shoulder joint. And so I would just draw from here to here. And that connects me at the upper point of the origin, but what about the lower point? So let's reach from the top of this muscle and draw a shape down to the lower point, right? Now, if I do that, this roughly looks like the outline of the latissimus, right? And then that gives me the muscle that I'm looking for. So this muscle is the latissimus dorsi. And now we get to figure out what it does. So all of these fibers run to the upper spine, so I can pull from my insertion point here on the arm towards this upper part of the spine. I could pull down along this fiber towards the middle connective point, or I could pull all the way down almost to the pelvic region along the lowest connection point. And so because I have such a diversity of anchoring points, that means that this muscle is pretty strong and also pretty diverse in terms of the kinds of movements that it can create. But all of these muscle fibers are pulling from the insertion point downwards, right? Because the shoulder is clearly higher and the humerus is clearly higher up, superior to the lumbar spine. So all of these things, if we put like arrows at the ends of all the fibers, give us the direction of pull. So we're going to pull the humerus down towards the lumbar spine. And so if you did that, you probably, if you had your arm down already, you'd just kind of reach behind yourself. But a good check is to do the opposite movement. And so go ahead and raise your hand up above your head. So bring your arm up, since this set of fibers seems to pull down. And then let's see if we can test this out. So if you're raising your hand above you, now I want you to see in what way can you move your arm from a hand raised position down towards your lumbar spine. What is the natural pathway, right? Now, as you do this, you may find that you can do all kinds of weird, wonky ways of trying to pull your arm down. We never studied any wonky ways. We talked about a couple of different ways to bring the arm down at the shoulder. We talked about a sagittal way, so we can bring our arm forward and continue to swing it down and back behind us. And we talked about a frontal way, so we could start up here and we can bring our arm all the way down to our side. Right? So those are your 2 options. And if we did this repeatedly, or if you did this with some weight, you might feel the latissimus dorsi engage, right? Because actually both of those things are possible. One is pulling to the upper connection, one is pulling to the lower. And so this is a muscle involved in both adduction of the arm, adduction, and it's responsible for extension of the arm at the shoulder. So now let's think about our antagonists. For this problem, if the latissimus is involved in adducting, bringing the arm down, and extension, bringing the arm down, then what are the muscles that are going to be responsible for bringing the arm back up, right? And so we want to think about that. There's a muscle that is in position to pull the arm up to the side, to abduct. Can you find it? Is there a muscle that has its fibers that can shorten to contract and pull the arm, just like if I was pulling on my sleeve, pull the arm from the humerus? Because we know an antagonist will probably share an insertion point because it has to move the same limb. So is there a muscle that is positioned so that it has a insertion point somewhere on the humerus and can pull to adduct along the frontal plane? Yeah, there is, right? We can look right here. We see one that has fibers that run along the outer sides of the arm. When these shorten to contract, they will bring the arm up towards the shoulder in adduction. So they'll move towards the origin. And that muscle is the deltoid. Again, using the same logic, we can say, what is an antagonist to the latissimus in terms of sagittal extension? So the latissimus can cause sagittal extension. So which arm muscle might be involved in flexion of the shoulder? Which arm muscle is going to help you to pull the arm straight up? Right? And so again, we're going to have to find a muscle that crosses the shoulder joint. And this one might be located more towards the anterior or lateral part of the body, not towards the back, so that it can pull up in this direction. Right? And again, deltoid looks like a good call for this one. Deltoid wraps all the way around to the front of your body. So let's look just back a few pages and find that deltoid muscle. Here it is. We can see those fibers are also in the front. So if I shortened from this point towards the front of its connection, that would pull my arm up to the top, right, in extension as opposed to abduction. So this is kind of a way that you can look for antagonistic reactions, and then also make sure that you test these out on your own arms or on your own limbs or body regions.